And efforts to get Americans vaccinated for the coronavirus are not happening as fast as many had hoped. The CDC reports the country is falling short of its goal to distribute 20 million vaccines by the end of the year. WMAR 2 News' Mark Roper is live outside the University of Maryland Medical Center in downtown Baltimore. And Mark, frontline healthcare workers are some of the first to get vaccinated. So how's that going so far?
Yeah, good morning, Megan. Well, officials here at UMMS say that any staff member who wants to get the vaccine should be able to have received their first dose, if not their second dose, by the middle of January, so really just a couple weeks away. And right now, Maryland is in phase 1A of the state's vaccination efforts. The first phase focuses on vaccinating people who are at the highest risk of developing complications from COVID-19 or their workplace puts them at risk, such as healthcare workers. Now, the Maryland Department of Health reports less than 1% of the population in the Baltimore region has been vaccinated. So far, a little more than 21,000 people have been vaccinated in Baltimore City, along with Anne Arundel, Baltimore, Carroll, Harford, and Howard counties. While those numbers do seem very low, the Baltimore region does fare better than the national capital region of Charles, Frederick, Montgomery, and Prince George's County, where less than 7,000 people have been vaccinated, or less than 0.3% of their population. With only about 2 million Americans vaccinated so far for COVID-19, the country is coming up millions short of its goal to vaccinate 20 million people by the end of 2020. Now, here in Maryland, the state has administered less than 20% of its vaccine supply. The health department believes that number will continue to grow as the process is beginning to ramp up. On Tuesday, the state reported the highest single-day total yet, which is more than 8,000 people vaccinated in one day. Bob Atlas, the president and CEO of the Maryland Hospital Association, explains some hospitals ran into shipping and logistical problems, but he also expects those problems will be fixed and believes vaccinations will increase by thousands soon.
These are, I guess, problems you'd almost expect. We're not seeing there's nothing catastrophic happening here. It's just a little bit of logistical mess.
Now, officials here at UMMS say they started out with a very limited supply of only about 1,000 doses 2 weeks ago, but since that time, they have been able to vaccinate more than 9,000 staff members. We're live in downtown Baltimore. Mark Roper, WMAR 2 News.